Joining us now is Dr. Jamie Taweel. And Dr. Taweel, thank you very much for joining us today on the show.
Thanks for having me.
It's good to have you here. So we've been talking about everything except medicine, so I'm glad you're here. You're an internal medicine specialist, so
Yes.
you probably, like every medical person, has been learning an awful lot or exercising your skills on the respiratory side.
Yeah, I mean, just waking up to just tons and tons of emails, different things that are changing, everything that's new that's coming out. We're getting constant information as on the daily, and I described it as working on a car as it's driving down the freeway almost,
Dr. Taweel, could you just start? I mean, I have a million questions for you, but before I roll into them, what's on your mind? What do you know the answers? You know the questions that I haven't even asked yet. Starting at the top of the list, what do you think people really need to know about the coronavirus as it impacts their health?
Well, I think, we're finding out that it's impacting everyone in different ways. So you're getting a lot of people that are just getting a pretty mild flu, all the way to the spectrum of people that are obviously on ventilators that are requiring a lot of things. This is a pretty significant disease that's impacting people differently. I think this is bringing a lot of attention now to people's, comorbidities. So I think people are starting to realize that, yeah, you got to get your diabetes under better control. You need to quit smoking. You need to do a lot of very important things for your health to basically reduce your risk for something like this to impact you as severely as it has. So, I think it's if anything positive can be gleaned out of this from a medical standpoint, I think it's just really increasing awareness that people need to be a little bit more vigilant about their health overall.
Well, no question about it. The communities that have been more affected, elderly people with that you've already said it, diabetics, high blood pressure, all the other things, they're the ones that have to be really careful. I can tell you, 61-year-old guy, a little overweight. I've been so good about my diet the last couple of weeks. It's been a lot easier looking at your mortality in the mirror. That's a wake up call for all of us. A really good point.
Absolutely.
So let's talk about the coronavirus itself. You're absolutely right. I kind of believe, that there's probably a bunch of us walking around. We use the term asymptomatic. Probably a bunch of people walking around with the coronavirus that their symptoms are so minor or just not present at all that they're probably walking around with the disease. What do you think?
Well, absolutely. Forgive me for just touching my face. I wash my hands.
Okay.
But yeah, absolutely. I mean, we do know that you can have this before you even begin to show symptoms for up to 2 weeks and to be able to transmit that. So, despite the fact that you may feel good and that people around you don't exhibit any obvious symptoms, you still have to consider the fact that they may be carrying that or you may be carrying that. Universal precautions is always going to be important.
Where do you weigh in on the face mask issue? We had the CDC now has changed their position a little bit. We're not going to get political. If you don't want to offer an opinion on this stuff, I get it. But, I was in the store yesterday. Almost everybody has adopted the face masks.
I don't think it's necessarily a bad thing. Certainly, I think it's a good thing for I'm going to defer. I'm not going to have a relatively strong opinion one way or the other. I'm going to defer to the CDC recommendations as always. And I do think face masks are definitely going to be helpful. The degree of helpfulness I'm not quite aware of, but I wouldn't take a risk. I mean, if it's easy for you to wear a face mask and reduce risk by even 1%, I think that's a risk worth taking. So
I'll tell you the one thing I saw yesterday, and I just got downright mad. Maybe there's a good reason for it, but I saw somebody at my local grocery store who did not look like they were a medical professional wearing an N95, and it's like, well, are you kidding me? You should give that to somebody that really needs a darn thing, right? Go buy yourself a bandana.
Those paint masks from back in the day, they're not wearing them properly.
Yeah.
I mean, N95s need to be fitted to you. The beard actually that I have right now makes it difficult for an N95. It has to be fitted differently. So yeah, if you're going to wear those masks, if you have them, obviously donate them. I'm getting calls from local areas to try and get masks that I may have that are extra, and I'm completely out. It's getting difficult. So if you have them, donate them, and if you have an old paint mask lying around, at least do the research to make sure you're wearing it appropriately.
Dr. Jamie Taweel is on the line with us. He's an internal medicine specialist joining us, giving us some local help, local thoughts here on the MegaCast. I'm Dave Scott along with Tyler Keefe. We thank you very much for joining us today. So, Doctor, I had somebody that I talked to the other day, a potential guest in the show. They said, hey, they couldn't come on the air because they just broken their collarbones. I said, well, are you okay? He said, yeah, I'm okay, but I can't go to the hospital. Would somebody normally go see their physician if they broke their collarbone? And are there a lot of things that right now we're not getting in front of medical professionals because of what's going on?
Well, absolutely. There's a lot of procedures that if anything can be held off, it's going to be. A collarbone repair, unfortunately, is tough to deal with. It can be, if it's a surgical fix, may get pushed down the line a little bit if it's non-emergent, because you're not going to want to use those ventilators. You're going to, obviously, the need for ventilators is going to supersede a surgery that may be pushed a little bit further down the road. So you're seeing a lot of that. I know in my practice specifically, we're trying to limit the amount of patients that are coming through. We're doing a lot of telemedicine phone calls. I'm doing a lot of these Zoom meetings with patients to try and get them refills on their medications, address their concerns, and of course to screen them to see if they meet criteria in order to go and have testing for COVID-19 as well. So we're trying to do the best we can. Things that can be pushed a little bit further down the road are going to be, obviously. And just like getting, taxes pushed a little bit further down and getting the courts closed. These are things that are, while essential in healthcare, they're not going to be immediate, emergent needs. So.
And Doctor, do you have any advice? I mean, we've gone back and forth with those of us on the show. We're all healthy. We are all at the very least asymptomatic. No one is getting anybody else sick. We've really isolated ourselves to ourselves, and we all live alone. So it's been working out pretty good. But I had a couple of moments, and some of the other folks had a couple of moments. We woke up with a little fever one day, and it's like, well, should I or shouldn't I? Do I call? Do I not call? What are your thoughts for people that aren't quite sure what to do?
I find people tend to fall into one of two categories. The people that don't give it enough attention and tend to blow it off versus the other that give every little sniffle the most attention, and neither side is particularly bad, more or less just ill-informed, I think. But what I think the best route to take is there's never a problem to just bounce it off a medical professional. You have physicians that are doing telemedicine calls. My practice specifically, you can call the office. I still have the phones open. I'm still answering online questions. I'm still doing telemedicine calls. There's never going to be a problem with getting someone's opinion. The advice that I'm giving, pretty much the standard advice is to assume nothing. If you're having any type of difficulties, if you're having a fever, you're not feeling well, tickle in the throat, dry cough, things like that, you have to raise the possibility that you might have coronavirus, COVID-19. If that is the case, typically, unless you're having any difficulty breathing, the sensation that you're suffocating and you cannot catch your breath, if that becomes an issue, then you need to go to the emergency room because that's something you can't really sit on. But if you're just feeling, mild symptoms, I have a sore throat, a little bit of a cough, nothing's too significant, I would advise you to do a stay-at-home order to at least 2 weeks, at least until your fevers break, for no less than 72 hours, and try to avoid passing this on. And hopefully this will be a mild case that most people will be able to get through.
All right, here's a crazy question. What do you think about Sanjay Gupta? I watch him on TV. He seems to have pretty good information most of the time. Seems to be and maybe some of the other doctors that we're seeing on television and during these broadcasts. I like Gupta even more. And I heard last night he's a Michigander. I didn't know that.
Yeah, I grew up in Novi.
Yeah, he did. We got to try and chase him down. He's a local boy. I think he's doing a pretty good job. And now, since I saw him on TV showing how to wash your hands, I'm always doing the Sanjay Gupta hand wash.
Absolutely.
Any thoughts about the media doctors that we're seeing on TV?
I think the media doctors are doing well. I think they're doing what the best that they can given the barrage of information that we're getting. Again, we're getting data thrown at us daily, and it's very tough to be able to discern who, we're getting it from multiple organizations, the CDC, the WHO, the AMA, everything keeps coming at us. And I think what the doctors on the media are doing are basically, they're generalizing a lot of it. Of course, in an outbreak, you're going to want to maintain social distancing. You're going to wash your hands. And if media personalities that are television, media personalities that are physicians are going to give you advice like that, that's fantastic. There's always going to be outliers. There are people that are going to tout theories and things that are unproven. Just make sure that you're able to do your own research to make sure that if they are suggesting cures or suggesting any type of treatment protocols that aren't basic, to do a little bit of research, ask your doctor. That's what we're here for.
Right, but doctors and patients can make their own decisions too, and certainly with the what's the drug that everyone's been talking about? I can't keep these multi-syllable.
Hydroxychloroquine.
Thank you, Tyler. You got that whole controversy, and you can weigh in on that if you want. But I think if I get in a situation, I want to be able to talk to my doctor about my personal situation, my personal risks, and be able to make our own decision for my situation. What are your thoughts?
Absolutely. I tell patients all the time, you may not know the medicine aspect of it, but what you do know is yourself. You know how you're feeling, how your symptoms are, how you're experiencing things. And that is significant. And that helps me do my job. The more information you give me, the better it is for me to be able to make decisions that are relevant to you. So certainly everyone's entitled to, I encourage you to ask your physicians to make sure that you're getting your questions answered. And that's another big thing. If a physician's being dismissive to your concerns, you need to raise that concern. You never want to not have your questions answered. It's what you're.
Yeah, the only thing I'm mad at my doctor about is I walked in there and said, Dave, you do know you're morbidly obese. There's got to be a nicer way to say it. Isn't there a nicer way to say that? Because,
there's absolutely no nice way to say that someone needs to lose a little bit. Absolutely.
Dr. Taweel, anything else you want to share with our audience? And we're going to zip along here if not.
No, stay safe out there. And thank you for having me on. If there's any questions I can answer, feel free to call me again at any time.
Can we keep in touch? Because I really appreciate your advice. And, maybe we'll turn you into another Dr. Sanjay Gupta here on our little broadcast. You did a great job today. All right.
Oh, thank you.
Thank you. He is one of our great local doctors, Dr. Jamie Taweel, and an internal medicine specialist, checking in with us via Zoom.